Happy evening, viewers. Welcome to yet another episode of GarbhaSandesha, episode number 42. Today's topic will be ways to increase IVF success rates. And to talk on this topic, we have Dr. Chaithra SK and Dr. Anitha Manoj. Dr. Chaithra SK is Assistant Medical Director at GarbhaGudi. He is a well-known fertility specialist with more than 11 years of experience in this field. She completed her fellowship in reproductive medicine from RGHS, and she has been practicing at our Kalyan Nagar and Marathali centers. Dr. Anitha Manoj has over a decade of experience as a gynecologist. She specializes in infertility and holds a fellowship in reproductive medicine from RGHS. She practices at our Hanmat Nagar Center. I welcome you both, doctors, to this today's episode. And first will be your take on today's topic. Straight, I'll go to Dr. Chaithra SK and Dr. Anitha Manoj, one after the other. Please, your take on today's topic, madam.
So happy afternoon to all the viewers. So today we will be discussing about various ways of increasing the success rates of IVF. So we all know that all couples, it's not like just we do a IVF and they will all have success rates. So we know that worldwide the IVF success rates is about 40 to 50% only. And in case if the couple is properly evaluated and planned prior to this IVF treatment, there are many ways where we can enhance this IVF success rates to more than 40-45% and try to achieve the pregnancy in the first attempt itself. So this includes careful history taking, evaluation, planning the IVF treatment in such a way that we don't miss any of the infertility factors, which are actually affecting their success rates. So at GarbhaGudi, this is how we differ from other IVF centers. We ensure that a proper treatment plan is done for all the couples in order to get the best success rates in the first attempt itself. So today we will be discussing all such measures which we take at GarbhaGudi to increase the success rates in the first attempt itself.
Thank you, madam. Dr. Anitha, would you please like to add anything?
Yes, sir. It's like we all know what is IVF also. So IVF is nothing but in vitro fertilization, where eggs will be taken out from the female patient and they will be fertilized with the husband's sperms outside in the lab. And after 3 to 5 days of growth, these embryos, the so-called fertilized egg, it's called embryo, and these embryos will be transferred into the female uterus, and then they will grow as the pregnancy. So to increase this, so when we transfer, the embryos has to attach to the uterus. The lining has to be good, embryo quality has to be good, egg quality, sperm quality. So the IVF success rate depends upon multiple factors. So today we will see what are those multiple factors which influence this IVF and success rate, how the success rate differs also. Like at the time of counseling, we'll be telling some percentage. Before transfer, we will be telling some percentage. Why the percentage difference? Why can't, like each couple, see, for example, every day, even just now one couple, they came and asked, why can't you give me 100% success rate in IVF? Anyway, we are going for the best treatment. So that why not 100% success rate? Why only 60 to 70%? All these things we'll discuss today.
Thank you, madam. ವೀಕ್ಷಕರಲ್ಲಿ ಒಂದು ವಿನಂತಿ, ಲೈಕ್ ನೀವು ಇವತ್ತಿನ ಟಾಪಿಕ್ ಬಗ್ಗೆ ಏನೇ ಕ್ವಶನ್ಸ್ ಇದ್ರು ಕನ್ನಡದಲ್ಲಾದ್ರೂ ಕೇಳಬಹುದು. ಅಂಡ್ ಇಬ್ರು ಡಾಕ್ಟರ್ಸ್ ಕೂಡ ಕನ್ನಡದಲ್ಲಿ ಪರಿಣಿತರಾಗಿರ್ತಾರೆ. ಹಾಗಂತಿದಾಗೇನೆ ಯಾರೋ ಮಂಜುಳಾ ಅಂತ ಒಬ್ಬರು ಪೇಷಂಟು ಚೈತ್ರಾ ಮೇಡಮ್ಗೆ ಕ್ವಶನ್. ಚೈತ್ರಾ ಮೇಡಮ್, ನಾನು ಗರ್ಭಗುಡಿ IVF ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೊಂಡೆ. ಫಸ್ಟ್ ಸೀಕ್ವೆನ್ಷಿಯಲ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಪಾಸಿಟಿವ್. ಆಫ್ಟರ್ 2 weeks it's miscarriage, and 7 months gap, next treatment and doctor transfer. We are a Manjula BN anta madam.
So our question next in failure aita antana, then she has not mentioned it.
First IVF treatment ತಗೊಂಡೆ, sequential treatment positive. After 2 weeks miscarriage ಆಯ್ತು. ಆಮೇಲೆ 7 month ಗ್ಯಾಪ್ ಕೊಟ್ಕೊಂಡು ನೆಕ್ಸ್ಟ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಇದು ಡಾಕ್ಟರ್ ಟ್ರಾನ್ಸ್ಫರ್ ಅಂತ ಹಾಕಿದ್ದಾರೆ. ಸೆಕೆಂಡ್ ಬ್ಲಾಸ್ಟೋಸಿಸ್ ಆನ್ day 24, 21. It's correct or wrong? Please tell me.
It's also negative. I don't have embryos. Okay. So ee patient ಅಲ್ಲಿ ನಾವು ಅರ್ಥ ಮಾಡ್ಕೋಬೇಕು. See, ಒಂದು couple first time IVF ಮಾಡ್ಬೇಕಾದ್ರೆ ಹಲವಾರು ಅಡ್ವಾನ್ಸ್ಡ್ ಟ್ರೀಟ್ಮೆಂಟ್ಸ್ ಇರುತ್ತೆ. ಸೊ ಅವ್ರಿಗೆ ಅಬಾರ್ಷನ್ ಪ್ರಿವೆನ್ಷನ್ ಗೆ ಕೆಲವು ಅಡ್ವಾನ್ಸ್ಡ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಇದೆ. ಸಕ್ಸಸ್ ರೇಟ್ಸ್ ನ ಇಂಪ್ರೂವ್ ಮಾಡೋದಕ್ಕೆ ಸೀಕ್ವೆನ್ಷಿಯಲ್ ಟ್ರಾನ್ಸ್ಫರ್ಸ್, ಬ್ಲಾಸ್ಟೋಸಿಸ್ ಟ್ರಾನ್ಸ್ಫರ್ ಅಂತ ಅಡ್ವಾನ್ಸ್ಡ್ ಟ್ರೀಟ್ಮೆಂಟ್ಸ್ ಇದೆ. ಸೊ ಈ ತರ ಇದ್ದಾಗ ಫಸ್ಟ್ IVF ಅಲ್ಲಿ ನಾರ್ಮಲಿ ನಾವು ಬ್ಲಾಸ್ಟೋಸಿಸ್ ಟ್ರಾನ್ಸ್ಫರ್ ನ ಎನ್ಕರೇಜ್ ಮಾಡ್ತೀವಿ. ಸೊ ಪೇಷಂಟ್ ಗೆ ಹಿಂದೆ ಅಬಾರ್ಷನ್ ಹಿಸ್ಟ್ರಿ ಇಲ್ದಿದ್ದಾಗ ಅನ್ನೆಸೆಸರಿ ಅಬಾರ್ಷನ್ ವರ್ಕ್ಅಪ್ ಮಾಡೋದು ಅಥವಾ ಎಂಬ್ರಿಯೋಸ್ ನ ಬಯೋಪ್ಸಿ ಮಾಡೋದು ಇದೆಲ್ಲ ನೆಸೆಸರಿ ಇರೋದಿಲ್ಲ. ಸೊ ಹಾಗಾಗಿ ಸಿಂಪಲ್ ಆಗಿ ಫಸ್ಟ್ ಟೈಮ್ ಬ್ಲಾಸ್ಟೋಸಿಸ್ ಟ್ರಾನ್ಸ್ಫರ್ ಯೂಶಲಿ ಆಲ್ಮೋಸ್ಟ್ 60% ಆಫ್ ಪೇಷಂಟ್ಸ್ ಫಸ್ಟ್ ಅಟೆಂಪ್ಟ್ ಅಲ್ಲಿ ಒಳ್ಳೆ ಬ್ಲಾಸ್ಟೋಸಿಸ್ಟ್ ಆಗಿದ್ರೆ ಅವ್ರಿಗೆ ಸಕ್ಸಸ್ ಆಗುತ್ತೆ. ಸೊ ಇವ್ರಿಗೂ ಕೂಡ ಸೀಕ್ವೆನ್ಷಿಯಲ್ ಟ್ರಾನ್ಸ್ಫರ್ ಆಗಿದೆ ಅಂದ್ರೆ ಬ್ಲಾಸ್ಟೋಸಿಸ್ಟ್ ಕನ್ವರ್ಷನ್ 2 ಸತಿನೂ ಚೆನ್ನಾಗಿದೆ. ಬಟ್ ಅನ್ಫಾರ್ಚುನೇಟ್ಲಿ ಒಂದ್ಸತಿ ಅಬಾರ್ಷನ್ ಆಗಿದೆ, ಒಂದ್ಸತಿ ನೆಗೆಟಿವ್ ಆಗಿದೆ. ಅಂದ್ರೆ ಅರ್ಥ ಸಸ್ಪಿಷನ್ ಇವಾಗ ಯಾವ ಕಡೆ ಬರುತ್ತೆ, ಒಂದ್ಸತಿ ಆಲ್ರೆಡಿ ಪ್ರೆಗ್ನೆಂಟ್ ಆಗಿರೋದ್ರಿಂದ ಅವ್ರದ್ದು ಯುಟ್ರೈನ್ ಫ್ಯಾಕ್ಟರ್ಸ್ ಪ್ರಾಬಬ್ಲಿ ಏನು ಪ್ರಾಬ್ಲಮ್ ಇರಲ್ಲ, ಇಂಪ್ಲಾಂಟೇಶನ್ ಆಲ್ರೆಡಿ ತೋರಿಸಿದೆ. ಸೊ ಯೂಶಲಿ ಫಸ್ಟ್ ಅಬಾರ್ಷನ್ಸ್ ಆಗೋದು, ನೆಗೆಟಿವ್ ಆಗೋದು ಮೇಜರ್ ಕಾಸ್ ಎಂಬ್ರಿಯೋ ಫ್ಯಾಕ್ಟರ್. ಆ ಭ್ರೂಣಗಳು ಏನಾಗಿರುತ್ತೆ ಅದರಲ್ಲಿ ತೊಂದರೆಗಳಿರೋ ಚಾನ್ಸಸ್ ಇರುತ್ತೆ, ಜೆನೆಟಿಕ್ ಪ್ರಾಬ್ಲಮ್ಸ್. ಸೊ ನೆಕ್ಸ್ಟ್ ಇವ್ರಿಗೆ ಎಂಬ್ರಿಯೋಸ್ ಇಲ್ದಲೇ ಇರೋ ಕಾರಣ ಇವ್ರಿಗೆ ಯಾಕೆ ಈ ತರ ಅಬಾರ್ಷನ್ ಆಯ್ತು ಅಥವಾ ಬ್ಲಾಸ್ಟೋಸಿಸ್ಟ್ ಕನ್ವರ್ಟ್ ಆದ್ರೂ ನೆಗೆಟಿವ್ ಆಯ್ತು ಅಂತ ಅರ್ಥ ಮಾಡ್ಕೊಳ್ಳೋದಕ್ಕೆ ಕೆಲವೊಂದು ಬ್ಲಡ್ ಟೆಸ್ಟ್ ಇರುತ್ತೆ. ಸ್ಪರ್ಮ್ ಸೆಲೆಕ್ಷನ್ ನ ಚೇಂಜ್ ಮಾಡ್ತೀವಿ, ಮಾಡ್ಬಿಟ್ಟು ಪ್ರಾಬಬ್ಲಿ ಎಂಬ್ರಿಯೋ ಬಯೋಪ್ಸಿ ಮಾಡ್ಕೊಂಡ್ರೆ ಅವ್ರಿಗೆ ಮತ್ತೆ ಅಬಾರ್ಷನ್ ಆಗೋದು, ನೆಗೆಟಿವ್ ಆಗೋ ಚಾನ್ಸ್ ಡ್ರಾಸ್ಟಿಕ್ ಆಗಿ ಕಡಿಮೆ ಆಗುತ್ತೆ. ಸೊ ನೆಕ್ಸ್ಟ್ IVF ಮಾಡಿಸ್ಬೇಕಾದ್ರೆ ನಮ್ದು ಪ್ರೀವಿಯಸ್ ಹಿಸ್ಟ್ರಿ ಪೇಷಂಟ್ ಏನಿದೆ ಅಂತ ನೋಡ್ಕೊಂಡು ನಾವೇ ಅದ್ರ ಮಾಡಿಫಿಕೇಶನ್ಸ್ ನ ಮಾಡಿ ಎಂಬ್ರಿಯೋ ಟ್ರಾನ್ಸ್ಫರ್ ಮಾಡಿದಾಗ ಡೆಫಿನೆಟ್ ಆಗಿ ಸಕ್ಸಸ್ ಆಗುತ್ತೆ. ಸೊ ಪೇಷಂಟ್ಸ್ ಒಂದ್ ಅರ್ಥ ಮಾಡ್ಕೋಬೇಕು, ಫಸ್ಟ್ ಅಟೆಂಪ್ಟ್ ಅಲ್ಲೇ ಎಲ್ಲಾ ತರದ ಅಡ್ವಾನ್ಸ್ಡ್ ಟ್ರೀಟ್ಮೆಂಟ್ಸ್ ನ ನಾವು ಆಫರ್ ಮಾಡಲ್ಲ. ಪೇಷಂಟ್ಸ್ ಪ್ರೀವಿಯಸ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಹಿಸ್ಟ್ರಿ ಹೇಗಿದೆ, ಇನ್ಫರ್ಟಿಲಿಟಿ ಕಾಸ್ ಏನಿದೆ ಇದನ್ನ ಅರ್ಥ ಮಾಡ್ಕೊಂಡು ನಾವು ಟ್ರೀಟ್ಮೆಂಟ್ ಫಾರ್ಮುಲೇಟ್ ಮಾಡಿರ್ತೀವಿ. ಅನ್ಫಾರ್ಚುನೇಟ್ಲಿ ಕೆಲವು ಪೇಷಂಟ್ಸ್ ಗೆ ಈ ತರ ಅಬಾರ್ಷನ್ಸ್ ನೆಗೆಟಿವ್ ಆದಾಗ ಮಾಡಿಫಿಕೇಶನ್ಸ್ ಮಾಡಿದಾಗ ನೆಕ್ಸ್ಟ್ ಸೈಕಲ್ ಅಲ್ಲಿ ಖಂಡಿತ ಒಳ್ಳೆ ರಿಸಲ್ಟ್ ಸಿಗುತ್ತೆ. ಸೊ ನನ್ನ ಸಜೆಷನ್ ಇವ್ರು ಬಂದು ಕಾಂಟ್ಯಾಕ್ಟ್ ಮಾಡಿ ಪ್ರೆಸ್ ಸೈಕಲ್ ವಿತ್ ಸಮ್ ಮಾಡಿಫಿಕೇಶನ್ಸ್ ನ ಮಾಡಿಸ್ಕೊಳ್ಳೋದು ಬೆಟರ್.
ಥ್ಯಾಂಕ್ ಯು ಮೇಡಮ್, ದಟ್ ವಾಸ್ ಅ ವೆರಿ ಕಾಂಪ್ರಿಹೆನ್ಸಿವ್ ಆನ್ಸರ್. ಮಂಜುಳಾ ಅವರೇ, ನಿಮಗೆ ಉತ್ತರ ಸಿಕ್ಕಿದೆ ಅಂತ ಅನ್ಕೋತೀವಿ. ಚೈತ್ರ ಮೇಡಮ್, ಫಸ್ಟ್ ಕ್ವಶನ್ ಕಮ್ಸ್ ಟು ಯು. ಕ್ಯಾನ್ ಯು ಎಕ್ಸ್ಪ್ಲೇನ್ ವಾಟ್ IVF ಈಸ್ and how common it is?
So IVF means in vitro fertilization, where we give ovarian stimulation to the female partner so that there will be multiple formations of the eggs. So at the end of roughly 10 to 12 days of stimulation, we retrieve these eggs under anesthesia. So whatever eggs are retrieved through the vagina under scan guidance, those eggs will be put into the for fertilization with husband's sperms or partner's sperms. So this procedure is called IVF, in vitro fertilization, where normally this procedure would have otherwise happened in a female's fallopian tube. Because of some block or some indication, we are doing it externally in the lab. So this is called in vitro fertilization, and the embryos are allowed to grow in the lab for 3 to 5 days. And then it will be transferred back to the womb of the female partner in order to facilitate implantation. So idralli one advanced thing is called as ICSI treatment. Like IVF means we allow natural fertilization to happen by placing the sperms and eggs together. Whereas in the next step, that is ICSI, intracytoplasmic sperm injection, we do a forceful fertilization where we select the husband or male partner's sperms and inject into the egg of the female partner so that we facilitate the fertilization. So the indications for IVF and ICSI, their treatment actually differs, and ICSI is more advanced when compared to an IVF treatment. So in a common man's word, it is called as test tube baby because it is done outside. The embryos are cultured or created in outside the environment of the body, that is in the artificial culture conditions of the lab. That is why it is called as test tube baby.
There is another second part to the question, madam. How common it is?
So when it comes to infertility, we know that almost 1 in 5 couples in urban areas are suffering. So if you take the total infertility percentage, it is almost touching about 15% or so now. So among these 15% of couples who are coming for hospital for treatment purposes, I would say almost about 30% of these patients will require IVF treatment. Rest all we can correct in simple methods of fertility treatments.
Okay, madam. Thank you. Next question, Shubha Biradar anta kelidare. Anitha madam.
Yes, sir.
Hi ma'am, 16-week baby, FHR 173 BPM ide. Normal heartbeat baby 110 to 160 iruttalla. 173 bandre normal la.
Definitely normal. There is nothing to worry about. See, normal agi initially when the pregnancy is diagnosed, our time only heartbeat will be around 100 male irbeku, like 100, 110, 120, 130. As the pregnancy belita iddange 160, 170, 180 kuda reach agbodu, nothing wrong. Adadmele after 28 weeks, again heartbeat ಸ್ವಲ್ಪ ಕಡಿಮೆ ಆಗ್ತಾ ಬರುತ್ತೆ. So delivery time ಅಲ್ಲಿ it will be like 100 to 160 we consider it as normal. 100 ಗಿಂತ ಕಡಿಮೆ ಹೋದ್ರೇನೆ ಬ್ರಾಡಿಕಾರ್ಡಿಯಾ, ಫೀಟಲ್ ಬ್ರಾಡಿಕಾರ್ಡಿಯಾ, ಎಮರ್ಜೆನ್ಸಿ ಇದು ಅದು ಅಂತ ಹೇಳ್ತೀವಿ. ಅದರ್ವೈಸ್ 100 to 160 is normal. ಡೆಲಿವರಿ ಟೈಮಲ್ಲಿ 160 ಮೇಲೆ ಹೋದ್ರೂ ಹಾರ್ಟ್ ರೇಟ್ ಬೇಬಿ ಈಸ್ ಇನ್ ಡಿಸ್ಟ್ರೆಸ್ ಅಂತ ಹೇಳ್ತೀವಿ. ಅಟ್ 16 weeks ಈವನ್ ಅಪ್ ಟು 180 ಹಾರ್ಟ್ ಬೀಟ್ ಈಸ್ ಆಲ್ಸೋ ವೆರಿ ಮಚ್ ನಾರ್ಮಲ್. ಇದ್ರ ಬಗ್ಗೆ ಏನೂ ಚಿಂತೆ ಬೇಡ, ಡೋಂಟ್ ವರಿ. ಸೊ ಅದಾದ್ಮೇಲೆ ಮಗು ಹುಟ್ಟಿದ ಮೇಲೆ ನಮ್ ಹಾರ್ಟ್ ಬೀಟ್ ಎಲ್ಲ 70 to 80 ಆರ್ ಮ್ಯಾಕ್ಸಿಮಮ್ 90 ಹೋಗುತ್ತಷ್ಟೇ. ಸೊ ಬೆಳೀತಾ ಹಾರ್ಟ್ ಬೀಟ್ ಕಡಿಮೆ ಆಗ್ತಾ ಬರುತ್ತೆ. ಸೊ ನಿಮ್ ಆನ್ಸರ್ಗೆ, ನಿಮ್ ಕ್ವೆಶನ್ಗೆ ಆನ್ಸರ್ ಬಂದು ಇಟ್ ಈಸ್ ವೆರಿ ಮಚ್ ನಾರ್ಮಲ್, ಡೋಂಟ್ ವರಿ.
Thank you, madam. And the next question comes to you only, madam. What are some lifestyle changes that can increase IVF success rates?
Yes, sir, this is very much required for the present generation actually. So like most of us, the first thing is when they get married also. Most of us, the present generation, they are getting married very late. Maybe the females after 30, men almost 35 plus, they're getting married because of the career oriented and other things. So lifestyle modifications andre, like one is food related and healthy food habits, healthy lifestyle, and and healthy environment, like whatever stress management and other things. Healthy food habits anta bandre, it's like we have to take more of fresh fruits, vegetables, green leafy vegetables. If you consume meat, you can consume low fat meat like fish or egg white and other things also, like more of seafood instead of going for more of red meat and other things. And burn the calories, like healthy lifestyle andre more of exercise. Along with the diet, go for exercise also. At least walk for 1 hour. Not necessary walking. You can jog also, jogging, swimming, any form of exercise, minimum of 1 hour and maximum how much ever you can do. So healthy lifestyle and healthy habits also, like avoiding unnecessary food like carbonated drinks, alcohol, smoking, and then junk food, street foods, all these things. At least once in a while eating outside food is fine, but not regular eating, regular consumption of instant foods, canned foods, store foods. So all these things, and weight management. So by doing all these things, we can manage our weight. We should manage our stress levels, and the wearing clothes also important. So like too much tight, for men especially, wearing too much of tight garments like jeans, wearing always jeans, wearing always, even for the women also, and working in heat, like hot conditions. If they're professionally, they are into like a heated environment, that also if you can avoid. And then too much of exposure to the Wi-Fi also, like always sitting and browsing, always sitting with a laptop, always working. So all these things also. So mainly stress management. So healthy habits, healthy diet, and healthy lifestyle. So all these three healthy things can improve the IVF success rate.
Thank you, madam. Chaithra madam, what steps should be taken to minimize the IVF cost and maximize the IVF success rates?
Okay, so this is one dilemma among all the patients, which center to offer. It says we have seen many patients coming, mostly trying to inquire what is the cost of the IVF treatment, comparing it with various IVF centers, and then going to a center where the most cheapest offer has been made. So one thing, it's always important to understand why a particular treatment has been offered. So when a doctor actually offers a treatment of IVF, just it's not like a simple IVF, because simple IVF cost may not differ from center to center. So you have to understand what is your age, your infertility factors, what are the things which are contributing to your infertility. It is not just doing IVF. There are some adjuvants which might be required, especially for some couples, because the infertility factor is such that. So to give one example, a patient who is having male factor, the sperm count is very minimal, hardly 1 million, 2 million, like that. They go to an IVF center, IVF cost has been explained. They go, suppose if they come to us, we will explain an IVF cost. We will try to do some genetic test to understand why the patient is having that minimal count, whether he is having any genetic factors which can be inherited by his son or daughter or whatever. So that is one thing. And in such cases, using the sperms from the ejaculate may not result in good fertilization and good quality of embryos. So we may have to do a testicular aspiration of the sperms. So definitely the cost of IVF will increase in case if we are going for a testicular aspiration. And based on the genetic test results, based on the previous history of their IVF outcomes and all, we may extend the culture to a blastocyst. We may suggest some biopsy of the embryos in order to ensure that there are no genetic abnormalities. So definitely there will be a huge difference in the cost. So it's always important for the couples to understand like what a center is offering to them. Why is that it's important to take up those advanced treatments, keeping their own history and previous treatment outcomes in mind? What is the cost involved out of it? Then it can be justified like why a particular center has probably told a higher cost in the treatment. And there are many areas where the cost can be cut down as well. So there is no need to, as we said, it's you need not blindly jump into all those things. So there may not be a requirement of some advanced treatments for some couples, like they are very young, their married life is short. We are doing IVF for, say, for example, for a tubal block. So in such cases, that couple may not require any other advanced IVF modalities. They can go for a simple IVF or a day 3 transfer or a day 5 transfer or so. So it's important that the couple understand why something has been offered, why some advanced treatments have been offered or not offered, and then decide like where they have to offer IVF. So don't simply go on the cost factor alone. It's important. So one thing, in case if they fail, then what? They have to repeat the whole of IVF at a higher cost, because many adjuvants get added for a first time failure and all. So keep all these things in mind. It's important that your embryos also get a suitable culture conditions, which is of course expensive ones, to have a trigas incubators. Make sure that the embryos are extended culture till blastocyst so that we can offer best success rates as well. So sit with your counselor or doctor, understand the cost, why something has been offered to you, and then make a informed, collective decision, and then opt for a treatment.
Thank you, madam. That was a very good answer. Now, next question comes to you only, Chaithra, madam. This is a viewer who has not mentioned his or her name. The question is, endometrial thickness is 7 mm. It's right to transfer embryos, please explain.
So yeah, so ideally we wait for an 8 or 9 millimeter endometrial thickness for a good, fairly good success rates. Now understand one thing, that it's not just the endometrial thickness which contributes for a success of IVF. There are other parameters also which we check along with the endometrial thickness. It could be the pattern of the endometrium, its vascularity, its Doppler values, what was the progesterone that day, how many embryos we have. All these things do matter when we decide whether it is wise to transfer at an endometrial thickness of 7 mm. Sometimes an endometrial thickness of 7 mm with all the Doppler parameters being normal is better than having an endometrial thickness of 9 mm with loss of pattern or with high Doppler values. So don't always go by the absolute value of the endometrial thickness. So we have so many, and a normal embryo transfer is also equally important. If your embryo itself is abnormal, no matter how good or thin the endometrial thickness is, you will not achieve a pregnancy or it will result in an abortion. So if you are confident that you have a good quality embryo, then even at a 7 millimeter thickness with all other parameters fulfilled, if that is what your maximum thickness it is coming, you can definitely go ahead with the embryo transfer. So discuss with your doctors, don't go absolutely by the number, discuss the other parameters, how good your embryo is, and then opt for a transfer.
Thank you, madam. Anitha madam, there is one viewer's question. Jannavi V is asking, my age is 33. Can I go for IVF? But we are poor people. How we can take any treatment? Any suggestions, please?
So, Mrs. Jannavi, age 33 years is not the criteria to go for IVF. So, like we don't know what for you have been advised IVF. First of all, you come down, we'll evaluate like how long you are married, what are the problems associated. We have to judge your like uterus, ovarian reserve, how are the egg follicular number in your eggs, your uterus size, endometrial lining, tubal patency also we should see, and we should see the male factor like husband semen analysis also we should do. If all these parameters are good, then we can go for a simpler treatments also like IUI, other things. If any of the problems are there like egg reserve is low, tubes blocked. I had 3 IUI failed and in HSG test my tubes are normal. Okay. So usually we give 3 to 4 cycles of IUI with the tubes patent. Since you are already gone for 3 cycles of IUI, yes, definitely even we also will suggest we go for IVF. So you can go for IVF, but the economical constraints you are having. If you come down to Garbhagudi, we have multiple offers. You can come and discuss. So like we have even ESI scheme also, and we have other discounts running around. Once you come down, you can get to know all those discounts, and through minimum packages, low cost packages which we have planned for socio-economically unstable people or low poor people, you can just make use of those schemes and have the IVF done also.
Thank you, madam. Next question is coming to you, Dr. Anitha. What steps can a couple take to seek medical help if they have difficulties conceiving naturally?
So what steps can couple take?
Yes.
So like a couple, as I told, for fertility or for pregnancy to achieve, one is female factor and male factor. So like around 30% female factor, 30% male factor will be contributed. And another 30% by both couple club together. Together they might have some common problems, and 10% will be all the problem, like everything, all tests will be normal, but still they won't be able to conceive. And another thing is, so this the fertility or the pregnancy achievement will depend upon not only these things, like mainly age and what are the difficulties, what problems they are having, and other things also. So any coital difficulties, so you just come down, just we have to evaluate you, as I already told you. Evaluate means first basic one, ultrasound to see where is the problem, blood investigation, semen analysis, identifying the problem. We identify the problem, and depending upon the problem, we'll suggest what steps we can take. So if there are only smaller problems with the smaller treatments, we can go ahead like ovulation induction and naturally trying for the pregnancy, or simple intrauterine insemination. Or if any major problems are there, we can correct it and go for an advanced treatment also like IVF or some other methods also.
Thank you, madam. Dr. Chaithra, how can pre-implantation genetic testing help increase IVF success rates?
So pre-implantation genetic test, rather than putting it this way, rather than increasing the success rates of IVF, it actually decreases the abortion rates in IVF. So that is the main thing why we perform pre-implantation genetic screening. So we have to understand there will be some couples who require this. So who are these? So first of all, to tell what is PGTA, that is pre-implantation genetic screening, or PGS. So we have to screen the embryos for any abnormalities before transferring it inside the endometrial cavity. So we have to understand, for majority of IVF failures and abortions, it is the genetic problem inside the embryo which contributes in majority of the cases. So in order to enhance the chances of implantation, and also at the same time to decrease the chances of biochemical pregnancies or abnormal babies or abortions, we do this test. So patients who have had a repeated IVF failures, patients with repeated abortions, patients who are having advanced age like more than 40, because in this patients the abnormality of the eggs also will be high. So these patients should opt for PGT, the pre-implantation genetic screening. And though all those patients who have some family history of genetic errors, which is can be transmitted from one generation to another, they also should identify for such problems in the embryos. So for such couples, this test is offered. So definitely it is not offered uniformly only to increase the success rates of IVF. It is actually done in a selective group of population who require this screening test in order to enhance their chances also, especially those who are failing repeatedly, and also all those patients who have genetic errors or repeated abortions.
Thank you, madam. Anitha, madam, what role does age play in IVF success rates?
Yes, sir. So now only Dr. Chaithra told what role the age plays. So like for female, above 30 years itself, see, when we come to the female only, usually the egg reserve or the ovarian reserve egg count will be very good. Even not only the count, even the quality will be very good between the ages of 20 to 30. That is the maximum reproductive potential. So above 30 years, the egg count starts falling. So after 35 years, 34 years only, there will be a rapid decline in the egg count. So even like after that, when the egg count declines, when they even go for advanced treatments at that time, the quality also declines, not only the number, but also the quality declines. So this is the main problem with the female age. That's why we keep telling, go for the treatment, go for evaluation, don't waste time. Because you might have money today or like you might earn money tomorrow, but age we will never get back. And that so that even that IVF option also it goes off when we waste the time. And for men also same thing. So age will reflect on the sperm. That is, semen quality, quantity will differ. As the age advances, not only the number and the motility, there will be the motility. The motility should be very good so that the sperms will move and meet the egg in vivo, that is inside the uterus. And same thing is required even if they're going for IVF, that is quality. And not only that, as the age advances, there is a called like DNA fragmentation index in the sperms. That fragmentation index will increase. It has to be less than 15%. That is like ideal. If it can be accepted, it is between 15 to 25% when they're going for IVF, because they will be selecting the sperms manually or by different methods, choosing which sperm is good. If it is going beyond 25%, so these sperm quality will decrease and their ability to produce embryos or fertilize egg and their ability to implant and those embryos implanting capacity also will decrease. Even if those embryos will get implanted also, the abortion rates will be very high for these people. So that is why the age plays a major role. So when the couple walks in like above 35 years for a female or above 40 or 45 years for a male, that is why the percentage of success rate will drop. And even good quality embryos, whichever microscopically appear good, though they implant, they can land up in abortions shortly.
So if you ask what is the biggest determinant of an IVF success, it is the age of the couple. There's no doubt about it.
Thank you for that addition, Dr. Chaithra. The next question is coming to you. And since we have very little time, I want Dr. Chaithra to address this question in a short period. Like, does IVF yield healthy babies?
Definitely, there is no doubt about it. It's been almost 40 years since we are doing IVF in India itself. And there have been many studies which has been carried out on IVF babies, their reproductive potential in future, their overall health conditions and all. And it has been found that the procedure of IVF or ICSI is not going to have any implications on the health of the babies who are born out of an IVF program. So definitely we have to leave this myth behind that IVF babies result in some abnormality or so. So incidental, whatever cases we hear about an abnormality, so one thing has to be kept in mind that IVF is generally done in patients with advanced maternal age or a paternal age. So they opt for IVF much later in their life. So because of their age itself, they will have per se chances of abnormalities in the baby because of abnormality in the oocytes, that is in the gametes, sperms or the eggs. So it is only because of these factors in the couple or a pre-existing genetic diseases in the couple, definitely not per se because of an IVF or ICSI treatment.
Thank you, madam. That's all we have time for. And with a reminder to all of viewers that Valentine's Day offer is still there and it is going to run for 3 more days. I would request all the viewers to avail this offer till 28th February. Free fertility screening is happening across all the centers of Garbhagudi. Please make avail of this offer. Thank you, doctors.
Thank you.
And that's all.